Dimatteo Jr., pharmacist, certified clinical nutritionist. Thank you for joining me today. We have another email here from a listener, and this is what Stacy writes. She says, "My husband and I are healthy and active. We walk daily, golf, etc. Unfortunately, my knees have started aching in the evenings. My daughter wants me to try yoga, but I'm not sure. Do you have any supplements you could recommend?" So I'll answer the first part, the yoga part. Yoga is excellent. And we do absolutely recommend starting with the basics whenever you have kind of an achy knee, okay? So you want to make sure there's nothing structural going on there, that would necessitate further treatment. And again, there's no structural damage. But as long as that's kind of been ruled out, do recommend activity. Activity is critical. You may think, well, if arthritis potentially could be what this is. If you've got the achy knee, maybe if you're overusing it, you could make it worse. Yes, there's an extreme level you could go to that would be harmful. But overall, studies have shown that mild to moderate exercise is actually very helpful. Now, specifically back to yoga, I recommend yoga for people. It's excellent for you mentally and physically. Probably don't link it to the type of movement or exercise that would be helpful in this case. You want to make sure you're really using that knee. So yoga, touches on that, of course. But I think I would be more along the lines of aerobic activity, weight resistance, weight-bearing activities, running, biking, lifting, those. I would go that avenue in terms of the knee. Again, not saying not to do yoga, but I'm saying if you're looking for the activity that's going to be helpful to the knee, I would go that way. Okay, but so keep doing what you're doing. Maybe add something a little to it. It's a little more aerobic than just walking. And maybe add some resistance to that does affect the knee and uses the legs, some lunges, etc. I think that's maybe the route I would go, again, to help with the knee pain. From a supplement standpoint, start with an anti-inflammatory. There are two that we would recommend. You may not have to jump into all these, but just depending maybe others listening where you are on the spectrum of what could potentially be arthritis or joint pain, okay, then you can add in these different products. So from an anti-inflammatory standpoint, that's essentially what you're doing. I have knee pain, I take an ibuprofen. It's about blocking inflammation, okay? So with these two supplements that I would recommend, they are both natural anti-inflammatories. The first one is omega-3, or omega-3 complete. That everybody's heard of omegas. It's good for so many different things. You're going to get those benefits from it. But in terms of the knee, again, it produces anti-inflammatories and blocks inflammatory pathways. So it kind of hits it from both ends. I'd start with 1 twice a day. You can go up to 2 twice a day on that. And then the second one is our turmeric matrix advanced. That is a turmeric extract, okay? And the forms of it, you can read about it on the site, but the forms of it really maximize the absorption and the effectiveness. As research has come a long way in terms of understanding what the best way to get turmeric into the body in the most efficient way and in the most effective way. This is the latest that we have found, okay? I would do 1 twice a day on that one. Again, these are both natural anti-inflammatories. You're not really overlapping because they are working via different pathways. All right, so that's kind of from the pain management standpoint. And then for getting to the root of the issue, it would be a glucosamine chondroitin MSM product, okay? Ours is Joint Essentials Plus. All right, that one I would recommend you do 2 twice a day. There's too much in there and too high doses for you to buy it and take 1 a day. We hear that kind of thing all the time. Well, I don't think you need to take 4 of something. I just take 1 a day. It's not going to help. You've got to get the therapeutic levels 2 twice a day, or just don't even bother, quite frankly. All right, the glucosamine component is going to increase synovial fluid. Synovial fluid is the part of the joint that helps keeps it lubricated, helps to prevent the rubbing, okay? The chondroitin component deals with the cartilage, okay, which is the physical barrier. All right, so I'm not going to make the claim that it's going to regenerate cartilage, your bone on bone. You take this and now you're going to be, back to where you were, but it's going to slow down the progression. It's going to provide the precursors, okay, and hopefully at least increase and repair the cartilage, okay? MSM, does decrease inflammation at the site, at the joint site, also is involved in protecting connective tissue, which again goes back to the cartilage. Another thing that's not talked about very often, but that studies have shown, is vitamin D. And we're linking vitamin D to so many different things, but there are multiple studies from multiple different sources showing that low vitamin D levels correlate with increased osteoarthritis and generalized joint pain. So vitamin D dosing, always complicated because you need a level to ideally monitor what dose you need. You may be extremely low, and 1,000 or 2,000 is not putting much of a dent in it. You may be just fine at that level, but it's always very level dependent, person dependent. But short of getting a level right now, we'd recommend 2,000 units a day. I think that, kind of to recap, you can start with an anti-inflammatory for the pain. If you get a diagnosis officially of arthritis, then I would definitely move on to the glucosamine chondroitin or the Joint Essentials Plus, and consider adding in that second anti-inflammatory, depending on how much results you're getting. Okay, with any of these, particularly with the glucosamine chondroitin, if you're evaluating that, you've got to give it 2 to 3 months. It's not something that's going to work in a week. Okay, the anti-inflammatory omega and turmeric, that's why I kind of recommended those first, especially without an official arthritis diagnosis, is because you can feel that a little quicker. But the glucosamine chondroitin, if it is osteoarthritis, is really going to get to the root, help to prevent things from getting worse, help to really improve the condition. And then vitamin D kind of in a separate category. Don't really know the mechanism of that, but many studies, again, have shown that link. And then, of course, with vitamin D, you're going to get so many other benefits as well. Thank you for joining me today. I'm Joe DiMatteo Jr. If you liked this video and liked what you heard, go to our YouTube page, hit subscribe, and make sure you ring the bell to make sure you're notified of all our new videos and content.